A serious medical illness can intrude into all aspects of your life. Your primary doctor and other VA providers are using their professional skills and medical tools to fight your disease. But sometimes the complications can seem overwhelming.
Yeah, I mean, they had me on in ICU for like almost 2 weeks. They nothing put needles and pens in me. Yeah, I couldn't get out of bed. I couldn't do nothing.
Symptoms of your illness may be multiplying, causing pain and suffering. The stress is felt by every member of your family. You might be seeing more medical specialists, but you still have unanswered questions about your treatments and what lies ahead.
Somebody said, well, you ought to look into this, see what they could do for you. So they accepted me. And, I'm glad they did.
It makes you wish for a service that coordinates your care, gives you options, and relieves your suffering, even while your usual medical team continues to treat your disease. That service has a name, and it's called palliative care.
I would tell them, first of all, hospice and palliative care is outstanding, very. They did all they could for me, and I see what they do for all the veterans.
Palliative care has become a major commitment across the VA health system and part of every enrolled veteran's uniform benefits package.
We can be a source of continuity for patients that are often in a very complicated health system with lots of doctors giving opinions and lots of complicated decisions to be made. We could serve as an advocate for those patients. There's consistency with the support that we can give them and follow them in so many different sites of care. So in between hospitalizations, we can follow those patients in the outpatient setting, as well as into intensive care units, and then into perhaps settings of long-term care like our hospice and palliative care unit. But really what we're talking about is good, holistic, comprehensive care to address the needs of patients throughout the course of a chronic illness that may eventually result in death, but have needs throughout the course of their illness.
Palliative care is a specialized medical service designed to complement other medical treatment approaches, while zeroing in on how serious illness affects you as a person in all areas of your life. It emphasizes comfort, coping, and making the quality of your life the best it can be.
Pretty much everything we do in palliative care feeds off of the goals of the patient. What are their goals for care? Palliative care is not typically geared towards cure. It doesn't mean that it can't be given simultaneously to the pursuit of cure, but it is usually focused on comfort measures, and that involves all those aspects I talked about with perhaps a chaplain, maybe a social worker, certainly a nurse and physician, and probably many others being involved in trying to find out how can we help that veteran achieve their goals. And number one on my job description is relief of suffering and helping veterans to be more comfortable, and when they're more comfortable, the family is generally more comfortable.
Palliative care looks at what the veteran wants. What quality of life do they want? What are their expectations? How do they foresee their future? It's more of a holistic looking at mind, body, and soul.
Definitely agree that palliative care is a mix of good medicine and good humanistic care.
How do you know if palliative care could help your situation? Actually, palliative care should be a part of your medical care when any serious illness begins to have a major impact on your life. It's there for people who have been diagnosed with cancer, heart, lung, or liver disease, or dementias such as Alzheimer's. If you just feel like you don't know where to turn next, that might be the time to turn to palliative care.
So I think the stereotype of palliative care is that we're going to withdraw care, but what we're actually doing is adding a lot of care. And the sorts of care that we're providing are aggressive symptom management, aggressive pain control, aggressive nausea and vomiting control, making sure constipation and dyspnea are well tended to, so that patients have the ability to interact with their family and have the most quality of life at the end of life, or quality of life throughout the treatment of an illness.
Palliative care is provided by a specially trained team of health professionals. In VA, that team includes a doctor, a nurse, a social worker, a chaplain, and a psychologist or mental health professional. They may be complemented, in some cases, by personal care aides, pharmacists, volunteers, or other professionals. This team approach manages the complexities of how a serious illness can impact your life, including physical, emotional, spiritual, and practical issues.
So maybe one way would be to describe how I introduce the team when I come into a room for the first time and meet a patient. So I say we're the palliative care team. We're here to see patients in the hospital who have serious illnesses, and we are here to be your advocates in many ways. We want to make sure that all of your symptoms are addressed, and that is including pain, but also nausea, constipation, anxiety, any sadness you might feel. It's also to make sure that your voice is being heard and all your questions are being answered. And lastly, we really want to help give you support. And the support we want to give you is to help make sure that you are happy and feel safe once you leave the hospital, but also to make sure you have the psychological support that you might need as well as the spiritual support.
Typically, palliative care professionals are asked by your primary care physician to talk with you about what might make you feel more comfortable, and then make recommendations for achieving that goal. Care can be provided on a special palliative care unit in a hospital or nursing facility, or healthcare providers may come to your home.
We are very much patient-focused, that we want to know what's important for the patient. What are the patient's goals? What are the family's goals? How can we design a treatment plan that's going to help the patient and the family to meet those goals?
Hospice is the part of palliative care that offers highly specialized treatment when life expectancy might be measured in months rather than years. If your doctor suggests hospice, it may be because you need extra help in living with an illness that has become more advanced. VA also assists with arranging bereavement services for surviving family members, which can be of great help to your loved ones.
Hospice care doesn't just help the veteran, it helps the veteran's family. The ability to interact, to give the family a break, to give them a chance to take a deep breath and know that there's somebody else there that cares. That's something everybody needs. The sense of self-worth that's given to them, the sense of not being a burden. That's huge. Hospice has that capability.
I couldn't take care of myself, and because I had no help also, like her, I had no help. And I tried, but it didn't work out. My blood pressure was very high with the stress, and I'm much better than I was.
I use my father as an example. Without that resource, I firmly believe he would have died sooner, and he would have died with less dignity.
All the people here, all the nurses, doctors, assistants, everybody, even the social worker, they're beautiful people. They went out of the way to help me. This is my fellow vets. I feel a lot more comfortable around them, And I said, if I want to go, this is the place I want to go. I was just afraid if I left here, I wouldn't have nothing like this. This is like my home, my real home.
We actually try to promote quality of life until death. So this is not your typical unit where you come and it's quiet and they're in their rooms. We try to have everybody in the day room daily. We interact with them, the families are here, and we really enjoy the families to be part of what goes on here and to really make the families part of our family. And we always say that, now you're part of our family here on 7B.
It's been so good for him. He was dying so horribly when he was home. I mean, he was in 4 hospitals back and forth and hooked up to all kinds of things. Here, I don't know what they're doing, but it's like a miracle. He's been really much, much better. And he can at least function and be a little happy, and that's, it's really like a miracle.
And I think the gift that hospice has with others is to say, we are willing to be with you even in your fear. We are willing to talk about the things that no one else wants to talk to you about. We are willing to be with you at this time. And the surprise of all of that, the outcome of all of that often is that people are no longer afraid and they open up.
VA palliative care teams have improved the lives of many veteran patients and their families, adjusting pain medications, setting up home health care for veterans who live in rural areas, and helping to arrange inpatient hospice care for veterans unable to remain at home.
What could we do better in terms of your care? What could we work on?
The actual care I've received, I really, again, think of it, as I said, my experience has been completely positive with the nursing, the doctors and the nursing care. And again, everybody's very kind. They're concerned with what you're doing, that you keep doing things, you know, walk around and have some activities, and really just positive all the way around.
We used to see the wife come here every day driving 60 miles just because she didn't have that trust in what the care we provide or we could do for the veteran. But over a period of 2 weeks, she started coming less and less. And not that we didn't want her to be interactive, and I picked up a phone and called. Is there something which I can help? Is transportation an issue? Things of that nature. Her answer was simple and sweet. He said, I trust you guys now. You know, you provide a good care. I don't have to be there every day.
VA is offering these services because we believe it can help veterans and their family members better cope with serious illness and end-of-life care issues.
I come here and then I see him and I'm happy that he's happy, you know.
It's a new and important part of our healthcare resources we offer for veterans.
It gave me great pleasure to knowing that these are vets and they do a great deal for our country, and I can do something for them in return by helping them.
I hope again to see more patients towards the beginnings of their illnesses and become advocates for them across the whole span of their disease.
It's something much more than just medical care.
The day we came in, there was a plaque saying, "Welcome, John R. Malloy, and thank you for your service." And I knew that we belonged here. We really did.
Here's what you can do to learn more about palliative care. Ask your doctor about it. If you think it might be helpful, let the palliative care team come and talk with you about your needs and how they can help. More than that, you should expect excellent palliative care from VA to promote comfort and coping.